In this video I will discuss the common skin lesions you will encounter in usual clinical practice. A macule is a flat lesion that is usually circumscribed and non-palpable because it is not elevated above the skin surface. A papule is also a circumscribed lesion, but it is palpable. They are smaller in size, typically less than 0.5 centimeters in diameter. A plaque is a larger palpable lesion. Its top is flat, and it is raised above the skin surface. A pustule is a yellow-white pus-filled lesion, which is raised above the skin surface, hence palpable. They commonly occur due to infection, however there are non-infective causes as well. A vesicle is a small fluid-filled blister, typically seen in impetigo and various bacterial infections. Bulla is a larger fluid-filled blister, measuring more than 1 centimeter in diameter. They commonly occur in bullous impetigo and bullous pemphigoid. Crusting is caused by dried serum or exudate, typically after rupture of vesicles or bulla. Papule are pinhead-sized non-blanching areas of hemorrhage. Purpura is a large macule or papule of blood in the skin which does not blanch on pressure. Ecchymosis is a large confluent area of purpura. In lignification, epidermis become thicker with normal prominent skin markings. Finally, an excoriation is a superficial skin abrasion which is usually due to scratching.
Thank you.
Please like and subscribe.